Well, they say it's safer, less expensive, and less invasive than having your tubes tied.
So why are so many women complaining about a certain form of birth control? ABC 2 News investigator Josie Sturman is here now. She joins us with more on this. Josie?
Kelly, women from across the country want this product pulled off the market, saying it caused them pain after they put it inside their bodies. And tonight at 11, their complications range from bloating and belly pain to full-blown cysts. It's all coming from some metal coils they put inside their fallopian tubes, basically tying their tubes without actually needing surgery. But instead of birth control, these ladies say they had a medical nightmare, one they're now sharing by the thousands on Facebook.
I went in and I was, as selfish as it sounds, I was almost relieved, and I felt validated that it wasn't just me, that it wasn't, psychological, that there was thousands and thousands of women and family going through this.
Tonight at 11, we dig into those FDA reports to see how many adverse reactions have been reported by the company that makes Essure, and we'll let you know what one factor may put a lot of women at risk for complications if they get it. Now, deciding on birth control, a very, very personal decision. That's why we brought in Dr. Lee Matlaga from MedStar Health at Franklin Square to talk about this. Essure is a product you have experience with, and this whole issue just brings up a topic that you've really got to have a lot of conversation with your doctor before you choose any birth control. Talk about informing your patients about things like this.
I really think you do. You have to talk with them about the array of options, and they have to ask questions, and they have to feel comfortable doing independent research. The internet is a great resource, but they have to look at the sites and come back to their doctor, FDA sites, etc., to look at, different complications of different procedures. There's the tubal ligation, the Essure for permanent sterilization, but there are also a lot of IUDs and reversible methods, and we want people to have good options for birth control. We just want to make sure they're getting a lot of good information.
How do you help them decide? What factors go into choosing the right birth control for any woman? Because some women have tried lots of different kinds.
Well, you have to look at risk factors. So things as simple as the pill do have increased risk of stroke, pulmonary embolism, deep venous thrombosis. So it seems more benign, but not so much. And you need to tell them about the different risks and let them make an informed decision. Make sure that they understand the permanent nature of these procedures, like the Essure, understand the idea of having a device inside, whether it be something within the arm or within the uterus. And I think there are multiple benefits to all these different methods. It's not going to work for every person, and they need to know if there are any reversible side effects or any things that might still bother them in spite of intervention thereafter.
And in the course of doing this story, we started to look at these FDA reports through MAUD, which is a database that the government puts together, and we got a lot of information that way. Even as a woman and as a patient, I'd never looked there before. Would you advise your patients before they come in to talk about birth control to do that kind of research on the FDA or any other websites before they talk to you?
I think it's a great idea, because information is always going to be power, and there's always going to be things that are very personal decision, and everything has health risks, including pregnancy as well.
So in going forward, when you're choosing this, you had a bunch of options. You brought us some today. NuvaRing, that's something new that people can choose?
Right. The ring has estrogen and progesterone, essentially like a birth control pill. The ring, the patch, and there are 100 different kinds of pills. There are IUDs. This is a little sample of the Mirena IUD, which goes inside the uterus, so it's something implanted within the office in a procedure. There's also a Paragard IUD, which is hormone-free. This is an example of Nexplanon, which is a small little rod that's implanted within their arms, similar to sort of a Depo-Provera injection, but it's a 3-year progesterone birth control. So some people are really interested in the hormone-free, some people are really interested in the reversible, the permanent, but they have to know that everything has its pluses and negatives.
And they've got to really do their research, have honest, thought-provoking conversation with their doctors before they decide these things.
Exactly, and they may come in with one idea and come out with another idea, or need to think about something for, weeks or months before they proceed. So there's a lot of information out there.
Time you got to take, research you got to do. Dr. Lee Matlaga from MedStar Health at Franklin Square, thanks so much for joining us. And you can read more about choosing birth control on our website, abc2news.com.